Stone, you visit a lot of VA facilities across the country. How does the Clarksburg VA facility stack up?
I do visit a lot of facilities, and I will tell you that the Clarksburg facility is one of the top line facilities for us. This is an excellent facility and has been for the last 70 years. It's why we're also heartbroken over the events that occurred more than a year ago and so hopeful for closure to come. Veterans come here at the rate of about 10,000 individual veterans a month. And we did over 30,000 visits with veterans last month alone. And I will say to you that the care here is excellent.
That's good to hear. Now, what would you say to the average patient or patient's family who has legitimate concerns about coming to the Clarksburg VA for treatment?
I said a little bit earlier that this is a place that's been here for 70 years. These are 1,000 employees that are members of this community. They are hurting as much as this community is, but I can tell you that the care here is safe. You know, when we identified that there was a problem here, that employee was immediately removed from care, and it was turned over to the justice authorities, and we're anxious for justice to be served. We delivered the accountability that we should have, but this is a safe place to come, and veterans need to stay with us. You know, this is a unique area of this country. In north central West Virginia has an extraordinary rates of service. So there's 70,000 veterans that surround us. There's a hallway upstairs identifying more than 25 Congressional Medal of Honor winners that come from north central West Virginia. We have a responsibility to these families, and we're going to continue to serve them and serve them the best we can.
And now you mentioned when the staff learned about these allegations, how do you think they handled that?
I think they handled it well. I think that the first question is, why has this happened, and then how has this happened? But they went directly to management. And the management went directly to the independent inspector general who's responsible for the criminal investigations. And it is the responsibility of the independent inspector general to really bring this to conclusion along with the Justice Department. So we're anxious to have this come to conclusion. I want you to think about the fact that the vast majority of our employees here have been here at least a decade. These are proud people, and they're proud of what they deliver, and we're proud of them. And we want to stand with them. This management team is excellent. Our facility manager here, our medical center director here, has been here since 1991. This is a good person with a good team. He has structured the team so that quality issues come to him directly. The quality leader is part of the senior management team. This is the right structure, it's the right management team, and these are the right people to continue delivering health care to the veterans in this community.
Now, this incident has broken a lot of veterans' trust. What changes in policy or procedures has the department implemented since the incident came to light?
So I can't tell you that it's broken a lot of veterans' trust, and I can't tell you I agree with that statement. In fact, our most recent studies show that trust in the Clarksburg facility and our healthcare here is approaching 90%. It's higher than the rest of the nation. In fact, I've just been up on the floors talking to our employees, and our employees talk about the fact that the veterans that want to talk about this, that are coming into the emergency room or coming into our chronic living facility or our acute care facility, are saying to us how much they appreciate the care they're getting. Now, what procedures have we done? We've gone through every bit of procedure that we have and made sure that it is safe, and reassured ourselves, as well as the Joint Commission was here just recently taking a look at the facility and gave us a clean bill of health.
Now, when it comes to changes, are there any changes when it comes to security of how the medicine is administered to patients?
I think we've taken a look at locking up some of the materials. There's been discussion, I can't go too far with this, of whether this was insulin. In my whole career as a physician, in the military or not in the military, insulin was never a secured substance. You wanted it to be available quickly, both for diabetics as well as for other types of emergencies. We have actually begun to secure that, and I'm quite satisfied that the procedures in place are safe and will continue to be so. But this facility has gone beyond what most facilities in America would do with that substance.
And now, I know you can't give specifics about the investigation because it's pending, but what are the plans in place to address the specifics once the investigation's over?
So this is in the hands of the Justice Department. We in the Veterans Health Administration and the VA have done what we should do for accountability. We've terminated the employee. We've made sure that there's nothing else that appears to be going on. I just talked about the processes we went through. It is now in the hands of those people that deliver justice. And our hope, just like every member of this community and the heartbroken families that are victims of this, are hopeful for justice to be done.
Now, if you could address the families, do you have a message for them?
Yeah, our hearts go out to them. And we are deeply troubled and saddened. We've been in this community. We are your neighbors. We are fellow veterans. I am a veteran. My dad is a veteran. And we are heartbroken over this. That's little consolation for them. But all I can say is that we do our best to make sure that every one of our employees acts in an honorable and ethical manner. You cannot judge 1,000 employees based on one bad apple, and you cannot tarnish 1,000 employees with the action of one criminal. Criminals that are intent on doing criminal activity will find out a way to do that. That said, our job is to root them out as quickly as we can, notify the authorities, just like any one of us should do, and then hope for justice to be done.
Well, thank you very much for your time. Was there anything else you'd like to add?
No, I appreciate your time and appreciate the people of this part of West Virginia and what they represent. And as a fellow veteran, these are very proud people. And so thank you.